Our patient today is Clara. She's coming in because she is ready for her next step in cancer treatment. She is a 60-year-old white female. She is postmenopausal and has a past medical history of early stage non-metastatic breast cancer that was diagnosed in November 2018. Her cancer was ER/PR positive and HER2 negative. She had a lumpectomy and sentinel node biopsy, which was positive. She also has a history of DVT, hypertension, and depression. Her mother also had breast cancer. Clara is a non-smoker and drinks 4 glasses of wine per week and has 2 children. She has no known drug allergies, and her active medications include amlodipine 10 milligrams once daily and fluoxetine 40 milligrams once daily. Her past cancer treatments included chemotherapy with AC for 4 cycles and T for 12 cycles. She is up to date on all of her immunizations. She's currently reporting fatigue and arthralgias and some myalgias, but no other serious physical findings with that. Her blood pressure is 128/74. Heart rate is 74 beats per minute. Her temperature is 98.8 degrees Fahrenheit. Her oxygen level is at 98%. She is 66 inches tall and weighs 136 pounds. Her BMI is 22 and BSA is 1.7. For her labs, her BUN was 13 milligrams per deciliter. Serum creatinine is 0.9. Her white blood cells are a little low. They're 3,500 cells per milliliter. Creatinine clearance is 62 and current ejection fraction is 55. The biggest issue we have today is that we need to start hormonal therapy to further her cancer treatments, and that is just as a preventative for reoccurrence of her breast cancer. We want to make sure she's on this adjuvant hormonal therapy for prevention because her cancer was ER/PR positive. And we are going to be using an aromatase inhibitor because she was already postmenopausal when her cancer occurred, and the aromatase is a source of estrogen, which would affect her breast cancer considering it was the ER/PR positive. She's also contraindicated for tamoxifen as a preventative due to her history with DVT and her use of fluoxetine, which is an SSRI, and would inhibit the tamoxifen from working as well. We are going to be using exemestane. We're going to do 25 milligrams by mouth once daily, and we're going to keep that going for 5 years for her preventative therapy. With this medicine, she may experience some hot flashes, vaginal dryness, just more menopausal symptoms, continued arthralgias, osteoporosis symptoms, and mood changes, possible nausea. We want to monitor her bone density with bone mineral density scans just because the medication may decrease her bone density. We also want to keep a watch on her calcium and vitamin D levels due to that. Make sure she's getting enough in her daily diet. If not, maybe supplement that down the road. And overall, that is about it.